Clerkship grades in medical school are incredibly important. The latest survey data from the NRMP shows that program directors strongly consider your clerkship grades when deciding whether to offer you an interview, creating it as one of the most important factors in academic performance, especially your clerkship grade in your desired specialty, and even more important than your USMLE scores. Performing well in your clinical rotations will require a lot of forward planning and budgeting of your time. The two main categories of performance that you'll want to excel in are your clinical evaluations and your shelf exams, which usually weigh 50% and 25% of your clerkship grade. The other 25% will usually depend on your school. As for content review, if you want an incredible content review experience, I strongly recommend Sketchy Medical. Their clinical curriculum has full video courses for almost every clerkship, practice questions, and embedded in-video features for a fully integrated learning experience for maximum content retention. I'll talk more about Sketchy later in the video, including a 10% off discount code for all Sketchy subscriptions. So with that, let's get into how you can crush your clinical rotations to help match into the specialty of your choice. Subjective clinical evaluations will always be a major source of anxiety for medical students because it can be hard to know how you're doing in the eyes of your preceptor. And for medical students, we're so used to being in complete control of our grades based on how well we study for our exams. So giving up control of 50% of our final grade is unusually stressful. But there are some general principles and unwritten rules that you should know that'll give you the highest chance of success. The first of these is be smart about which hospital or clinical team you choose for your rotations. Most clerkship directors will send you an email at least a few weeks before the rotation asking you what your preferences are. You can reach out to students in the class above you or students in your own class that have already taken that rotation to figure out which clinical teams have preceptors that evaluate students well or provide excellent learning experiences for rotating third-year students. If you're entering a rotation for a specialty you're not going into, there's nothing wrong with choosing a team or hospital that is likely to give you more time to study for shelf. But on the other hand, for a rotation in a specialty you're strongly interested in, you would benefit from finding a team with a reputation for excellent learning opportunities, teaching experiences, networking opportunities in the department, and potential for letters of recommendation. For example, if you have the option to rotate with a neurology team at Hospital A that historically gives their students a chance at honors, and Hospital B, whose team has residents and attendings that are difficult to please or known to give mediocre evals, you would benefit from rotating at Hospital A. I'm not necessarily recommending to choose a hospital where you're going to do the least work, but with all else being equal, it's just a fact that some preceptors will grade tougher than others, which can eliminate your eligibility for honors in any clerkship. This is actually a serious issue because your evals weigh a whopping 50% of your final clerkship grade for each rotation. And like I mentioned before, program directors take these clerkship grades seriously. So once you've chosen to rotate where you're most likely to succeed, there are unwritten rules that will help you shine in any of your rotations. The first and probably most obvious of these: always be on time or early, and dress professionally. These are the simplest ways to show that you take your clerkship seriously. Never ask your team to leave early. Unless you have an emergency or a prior commitment that your team already knows about, there will be days where the day feels like it's dragging on and you have no idea how you can be helpful to the team. This happens to every student and it can happen in any rotation. Sometimes the days can be like that. Also, do yourself a favor, never use the phrase,
"So, is there anything else I can help with?"
Every resident on Earth knows that that's code for, "Can I please get the out of here?" Sometimes it's true that a resident will be caught up in their work so much that they forget that you're there and have a shelf to study for. But in my opinion, a much better way to get their attention and genuinely look for ways to help is asking to help them with specific tasks. Do you have any notes I can help finish? Do you need me to see the new console or admit? Did you get any new pages that I can answer for you? They might actually have some extra work for you to help take off their plate. And if they don't, and there's genuinely nothing for them to delegate to you, they're most likely gonna send you home. Another super important way to make a good impression on your team is asking thoughtful questions. I know this can be easier said than done because sometimes there's so much going going on with a patient that you don't even know what to ask about. But if you come up with any question at all, even if you think it's dumb, the answer to that question will help you understand the patient's illness and situation better, which in turn will help you contribute to the team. It shows the team that you're paying attention and being genuinely inquisitive about the patients on their service. Think of every patient on the service as your own. There will be many times throughout the day where a resident or attending will have a question about a patient. If their lab results are in, if their X-ray, CT, or MRI readings are in, and if there are any new recommendations from consulting services. These can all be found on the electronic medical record for your patients. And if you're the one that has the answer to those questions most of the time, it's gonna make you look like a rock star. It's a strong indicator to your evaluators that you're involved and invested in the patients on the service. A warning, please don't be a gunner. If you don't know, a gunner is any student that tries to make themselves look better by making their classmates look worse by comparison. I've seen this take many forms with students that I've worked with. Obviously, without saying any names, students talking bad about their classmates to attendings behind their classmates' back. And I've heard about a student who showed up to the hospital on a Saturday to work after telling their classmate that they had the day off. This just does not impress preceptors. They see right through that behavior. It shows them that you're probably not a great team player and probably reminds them of their least favorite gunners from medical school. In fact, a group of students that works very well as a team is better for everybody's eval. All of my best clinical evaluation grades were in rotations where my classmates and I genuinely enjoyed working together as a team and helping make each other look like studs. So as much as you will learn on your clinical rotations, you will need a solid foundation of content review and practice questions on your downtime to score highly on the shelf. For content review, I highly recommend Sketchy Medical for clinical medicine. Sketchy pharmacology and microbiology were absolutely essential for my Step 1 studying. I talk more about this in my Step 1 video, which you can find a link to here. Sketchy is changing the game for board studying with character-based memorization tools that are simple, effective, and fun for learning complex concepts. Sketchy now has a video course for the core clinical clerkships, medicine, surgery, OB-GYN, peds, and a neurology course that's coming soon. Click the link in the description and use promo code Tim Jalbert 10 for 10% off any Sketchy Medical subscription. Also, they don't have a psychiatry section yet, so for that, their Sketchy Pharmacology Neuropsych Drug section has 22 incredibly high-yield sketches for psychoactive drugs. And then to cover the rest of the psych content, the online med-ed psychiatry section is great to use in the meantime. I actually used online med-ed for content review in each of my core clerkships because I didn't have all of the same clinical sketchy courses available to me during my third year. Online med-ed is good for high-speed review of the most high-yield topics, but it won't cover everything that you'll need to get questions correct on UWorld and your shelf exams. So without a doubt, and if you watch any of my videos, you know which question bank I'm gonna tell you to use. And the one you should use for every single clerkship is UWorld. In my Step 2 CK study guide video, I went pretty in depth in how I structured my shelf studying and leveraged that into my Step 2 studying. You need to make sure you finish every question of your UWorld question bank for the clerkship that you're on. For example, when I was on my psych block, I found the number of questions that were in the psychiatry section of UWorld and budgeted out how many questions per day I would need to do up until about 3 days before the exam to give myself at least a few days to redo my incorrect answers and review my notes before the shelf exam. You want to give yourself at least 2 days to complete all your incorrect answers and an additional day to take off of studying before the shelf or to just casually review notes that you took during the rotation. Now, for certain rotations, you would actually benefit from an additional question bank, which brings me to the supplementary study resources that I would recommend for each clerkship. Not all study materials are going to be worth your time, but these are the ones that work best for me. For internal medicine, an essential is the Vine Intervention podcast, a fantastic rapid review you can use for shelf and Step 2. You can listen to it on your downtime when you're doing household chores, at the gym, walking your dog.
Peter.
He covers just about every concept in internal medicine in at least one of his podcast episodes, including things you would never think of. If you'd like to see my quick guide to Divine Intervention Podcast, you can click the link up here to check that out. If you go to divineinterventionpodcast.com, under podcast topics, you can find a link to all the podcast episodes that he makes for the internal medicine shelf. And if you want to get real crazy, you can listen to all the podcast episodes for the other clerkships too. For your surgery clerkship, Dr. Pastana's surgery notes is fantastic. It's a pretty short text written specifically for medical students and doctors that are studying for their board and licensure exams. Quiz questions are included at the end of each chapter as well. And I don't know about you, but I love practice questions because it helps test my knowledge. I got through most of this in the couple of days before my shelf exam and found it to be very helpful for several questions that popped up on my shelf. So for pediatrics, I used Case Files for Pediatrics, which tests you on signs, symptoms, diagnosis, and treatment of pediatric illnesses in case-based format. It was super effective for solidifying my knowledge over the course of my peds rotation. For OB-GYN, I would complete the practice questions on the ACOG website. Since ACOG creates all the guidelines for OB-GYN diagnosis and treatment, these practice questions test you on the highest yield concepts for the shelf. Finish and review these practice questions for an extra boost on your shelf score. For psychiatry, I used First Aid for the psychiatry clerkship, doing just one full pass. The psych residents I worked with couldn't recommend this text enough. It's a solid, information-dense read that covers just about all the information that you will need for the shelf. As I got through this textbook, I found a lot of newer and interesting content that I hadn't encountered previously, and so I was able to add these to my notes. The other additional resource that was crucial for psych for me was Sketchy Pharmacology's Neuro and Psych Drug section. I reviewed my Sketchy Pharm notes and rewatched a lot of the videos to refresh my memory, which helped me become extremely confident with my pharmacology knowledge. Since pharmacology is a dominant topic in psychiatry, I would highly recommend that. And finally, if you have a family medicine rotation, the AAFP question bank for medical students is absolutely essential. Family medicine is a very guideline-based specialty, and those guidelines can change year to year. So these practice questions have the most up-to-date guidelines, and because of that, this is the only situation that I would actually recommend using a question bank other than you would. So thanks for watching, guys. As a gift to all of you guys that have made it this far, I'm gonna leave a link to my shelf and step 2 notes that I compiled over my entire third year and step 2 dedicated. It took me a long time to convert the notes from Microsoft OneNote to Notion, but I did that to make it easier for me to share the link on YouTube for you guys to access easily, and also easier for me to edit. I also had to remove a lot of the images and certain things that could get me into copyright trouble. My original notes were enriched with images, radiologic, H&E scans, CT scans, MRIs, and diagrams, but unfortunately I had to take them all out. As always, leave any questions in the comments and I'll answer as best as I can. And if you decide to subscribe to Sketchy Medical, don't forget to use the link in the description and use promo code TimJalbert10 to get your 10% discount. Good luck on your rotations and go crush your shelf exams. Let me know how it goes and I'll see you in the next one.